Anthropometry, human measurement. Webster's New World Dictionary defines anthropometry as the science dealing with measurement of the human body in comparing individual and group differences. Why do we measure the body externally? If we wanted to analyze the structure and composition of the human body, we could begin by peeling away the skin and underlying subcutaneous adipose tissue. We could then remove the skeletal muscle, exposing the skeleton itself. At the end of this dissection, we could weigh these different tissues and get a quite accurate measurement of body composition and body structure. However, few people would volunteer for such procedures. Without advanced medical imaging techniques, we must make our measurements externally. Anthropometry includes the basic 4 measurements of weight, stature, sitting height, and arm span. Lengths of bones, breadths or widths of bones near their ends, girths or circumferences around body segments, skin fold thicknesses at landmarked sites. Anthropometry can be used to assess size, shape, proportion, composition, and gross function. It has applications in many areas of science and medicine, especially when expensive medical imaging techniques are not available. In studies related to genetic abnormalities, growth and development, malnutrition, obesity, eating disorders, drug dosages. Sport makes frequent use of anthropometry in the ongoing search for understanding the links between structure and function. In performances involving maximal strength, power, and endurance. Sport applications include relationships between structure and function, the structural characteristics of different sports, inter- and intra-athlete comparisons. Anthropometry can help us monitor our journey towards and through active health. And should be considered as a helpful guide in promoting the optimal growth and development of all the children of our world. There are applications in many other areas, such as in the design of workspaces in ergonomics, automobiles and operator environments, and even in clothing design and manufacturing. The primary purpose of this movie is to act as a supplement to a formal course in anthropometry, such as the one being taught here by Dr. Alan Martin.
Skin fold, we take the biceps, these calipers where we open them up, we have a look, we take the reading, and there it is. It just seems too easy, but in fact, there are, as you're finding out already, there are many steps in there where we can introduce serious error. You've already seen some of them, the calibration of the instrument. And I'm not even now talking about what you do with the numbers, as in putting them in the wrong equations. We will deal with that tomorrow.
And here is our guest instructor for the landmarks in this movie.
Hello, I'm Dr. Alan Martin, past president of the International Society for the Advancement of Anthropometry, otherwise known as ISAC. The techniques shown here are currently endorsed and taught by ISAC. The purpose of this movie is to present a consistent approach to the teaching of the techniques. Each technique will be presented in 3 phases. First, the preview, an overview of the measurement sequences and choreography. Second, the details, specific instructions about the individual techniques. And third, the review, a visual summary of the sequences and choreography. Before we take any actual measurements, we need to know where to take them. So the first thing we'll look at is the landmarks. Landmarks. There are 2 kinds of landmarks. The direct landmarks. These are made at the end of long bones to indicate the ends of body segments, or over other well-known bony processes to act as reference points for making indirect landmarks. The indirect landmarks. These are referenced and measured from the direct landmarks and are used to mark the sites for girth and skin fold measurements. It should be noted here that the ISAC convention for standard measurements is to take them all on the right side of the body. Thus, the landmarks are also located on the right side. However, this does not preclude the possibility of taking left side measurements when bilateral asymmetry is being investigated.
There is a sequence to landmarking. Landmarking generally consists of the following phases in sequence. Position the subject and body segment. Locate the bony landmark. Release and relocate the bony landmark. Mark its location. Check the mark after it's made. Finally, view the landmark while proceeding to the next one. Direct landmarks. Acromiali. Radiali. Stylion. Mesosternali. Iliospinali. Trochanterion. Tibiali laterali. Tibiali mediali. Spherion tibiali. Acromiali. Radiali. Stylion. Note that thick yellow lines are sometimes used during this movie to show the location of the landmarks. This is for didactic purposes only, since landmarks should always be made with a fine line in order to facilitate precision in measurement. Acromiali. Definition: the point on the superior aspect of the most lateral part of the acromion border. Subject position. The subject assumes a relaxed position with the arms hanging by the sides. The shoulder girdle should be in a mid position. Apply the straight edge of a pencil to the lateral aspect of the acromion to confirm the location of the most lateral part of the border. Mark this most lateral aspect. The acromion has an associated bone thickness. Palpate superiorly to the top margin of the acromion border in line with the most lateral aspect. Radiali. Definition: the point at the proximal and lateral border of the head of the radius. Subject position. The subject assumes a relaxed position with the arms hanging by the sides. Location: palpate downward into the lateral dimple of the right elbow. It should be possible to feel the space between the capitulum of the humerus and the head of the radius. Then move the thumb distally onto the most lateral part of the proximal radial head. Correct location can be checked by slight rotation of the forearm, which causes the head of the radius to rotate. Stylion. Radiali. Definition: the most distal point on the lateral margin of the styloid process of the radius. Subject position. The subject assumes a relaxed position with the arms hanging by the sides. The measurer lifts the wrist to locate the landmark. Location: using a thumbnail, the anthropometrist palpates in the triangular area identified by the muscle tendons of the wrist immediately above the thumb. This area is also called the anatomical snuff box. Once the snuff box has been identified, palpate proximally to correctly identify the tip of the styloid process. Acromiali. Radiali. Stylion. Mesosternali. Iliospinali. Mesosternali. Definition: the midpoint of the corpus sterni at the level of the center of the articulation of the fourth rib with the sternum, the chondrosternal articulation. Subject position: the subject assumes either a seated or standing position. Location: this landmark is located by palpation beginning from the top of the clavicles. Using the thumb, the anthropometrist should roll down from the clavicle to the first intercostal space, that is between the first and second ribs. The thumb is then replaced by the index finger, and the procedure is then repeated down to the second, third, and fourth intercostal spaces. The fourth rib is between the last two spaces. Iliospinali. Definition: the most inferior or undermost part of the tip of the anterior superior iliac spine. Subject position: the subject assumes a relaxed position. Location: the landmark is marked at the lower margin or edge where the bone can just be felt. Difficulty in appraising the landmark can be eased by the subject lifting the heel of the right foot and rotating the femur outward. Because the sartorius muscle originates at the iliospinali, this movement of the femur enables palpation of the muscle and tracing to its origin. Mesosternali. Iliospinali. Trochanterion. Tibiali laterali. Tibiali mediali. Spherion tibiali. Trochanterion. Definition: the most superior point on the greater trochanter of the femur, not the most lateral point. Subject position. The subject assumes a relaxed standing position with the right arm folded across the chest. Location. This site is identified by palpating the lateral aspect of the gluteal muscle with the heel of the hand while standing behind the subject. It is advisable to support the left side of the subject's pelvis with the left hand while applying pressure with the right hand. Once the greater trochanter has been identified, the measurer should palpate upward to locate the lowest point of the trochanter where its superior surface can still be felt when strong downward pressure is applied. Note that this site is difficult to locate in persons with thick adipose tissue over the greater trochanter. Tibiali laterali. Definition: the most superior point on the lateral border of the head of the tibia. This is often a difficult landmark to correctly locate due to thick lateral ligaments that run across the knee joint. Subject position. The subject assumes a relaxed standing position with the arms hanging by the sides. Location. Palpate the site using a thumbnail and the following guidelines. Locate the joint space bounded by the lateral condyle of the femur and the anterolateral portion of the lateral tibial condyle. Press inwards firmly in order to locate the superior and lateral border of the head of the tibia. It is often useful to have the subject flex and extend the knee several times to ensure that the correct position has been located, approximately 1/3 of the distance along the border, moving in an anterior-posterior direction. Tibiali mediali. Definition: the most superior point on the medial border of the head of the tibia. Subject position. The subject is seated with the right leg resting over the left knee so that the medial aspect of the leg can be marked. Location. Palpate the joint space bounded by the medial femoral condyle and the medial tibial condyle. The most superior point should be marked on the proximal medial border while the leg is held in this position. Spherion tibiali. Definition: the most distal tip of the medial malleolus. Subject position. The subject is seated with the right leg resting over the left knee so that the medial aspect of the leg is readily accessible. Location. This landmark may be located most easily by palpation with the thumbnail from beneath. It is the distal tip, not the most medial aspect of the medial malleolus. Trochanterion. Tibiali laterali. Tibiali mediali. Spherion tibiali. There are gender differences with some landmarks, in particular, iliospinali. The iliospinali is higher on the male than the female. During puberty, the female pelvis opens and flares downward, and the iliospinali is lower. When adjusting for clothing, point to the site and tell the subject you wish to make a mark at that point. Females generally pull up the leg of their shorts to assist the anthropometrist in marking the site, while males pull their shorts down at the waist. Acromiali. Radiali. Stylion. Mesosternali. Iliospinali. Trochanterion. Tibiali laterali. Tibiali mediali. Spherion tibiali.
Indirect landmarks.
Midacromiali radiali. Triceps skin fold site. Biceps skin fold site. Mid-stylion. Subscapulari. Subscapular skin fold site. Abdominal skin fold site. Iliocrystale. Iliac crest skin fold site. Supraspinale skin fold site. Mid-trochanterian tibiale laterale. Front thigh skin fold site. Medial calf skin fold site. Mid-acromiale radiale. Definition: the midpoint of the straight line joining the acromiale and the radiale. Subject position: the subject assumes a relaxed position with the arms hanging by the sides. Location: measure the linear distance between the acromiale and radiale landmarks with the arm relaxed and extended by the side. The best way to measure this is with a segmometer or large sliding caliper. It is not acceptable to follow the curvature of the surface of the arm. Place a small mark at the level of the midpoint between these two landmarks. Project this mark around to the posterior and anterior surfaces of the arm as a horizontal line. This is required for locating the triceps and biceps skin fold sites. Triceps and biceps skin fold site. Triceps skin fold site. Definition: the point on the posterior surface of the arm in the midline at the level of the marked mid-acromiale radiale landmark. Biceps skin fold site. Definition: the point on the anterior surface of the arm in the midline at the level of the mid-acromiale radiale landmark. Mid-stylion. Definition: the midpoint on the anterior palmar surface of the wrist, of the horizontal line at the level of the stylion. Subject position. The subject assumes a relaxed position with the arms hanging by the sides. The measurer lifts the wrist to locate the landmark. Location. The tape is aligned with the stylion landmark, and a line perpendicular to the long axis of the forearm is drawn close to the midpoint of the wrist. The midpoint is estimated between the medial and lateral edges of the wrist. A line is drawn at this position which intersects the perpendicular line. Subscapular skin fold site. Subscapulari. Definition: the undermost tip of the inferior angle of the scapula. Subject position. The subject assumes a relaxed standing position with the arms hanging by the sides. Location: palpate the inferior angle of the scapula with the left thumb. If there is difficulty locating the inferior angle of the scapula, have the subject slowly reach behind the back with the right arm. The inferior angle of the scapula should then be felt continuously as the hand is again placed by the side of the body. A final check of this landmark should be made with the hand by the side in the relaxed position. Subscapular skin fold site. Definition: the site 2 centimeters along a line running laterally and obliquely downward from the subscapulary landmark at a 45-degree angle. Subject position. The subject assumes a relaxed standing position with the arms hanging by the sides. Location: use a tape measure to locate the point 2 centimeters from the subscapulary in a line 45 degrees laterally downward. Abdominal skin fold site. Definition: the point 5 centimeters horizontally to the right-hand side of the omphalion, the midpoint of the navel. Subject position. The subject assumes a relaxed standing position with the arms hanging by the sides. Location: the site is identified by a longitudinal measure of 5 centimeters to the subject's right from the omphalion. The skin fold taken at this site is a vertical fold. Note that the distance of 5 centimeters assumes an adult height of approximately 170 centimeters. Where height differs markedly from this, the distance should be scaled for height. Iliac crest skin fold site. Iliocrystale. Definition: the point on the iliac crest where a line drawn from the mid-axilla, that is the middle of the armpit, on the longitudinal axis of the body, meets the ilium. Subject position. The subject assumes a relaxed position with the left arm hanging by the side and the right arm folded across the chest. Location: find the general location of the top of the iliac crest. Once identified, draw a horizontal line at the level of the iliac crest. Draw an imaginary line from the mid-axilla down the midline of the body. The landmark is at the intersection of these two lines. Iliac crest skin fold site. Definition: the site at the center of the skin fold raised immediately above the mark iliocrystale. Subject position. The subject assumes a relaxed position with the right arm folded across the chest. Location. This skin fold is raised superior to the iliocrystale. To do this, place the left thumb tip on the marked iliocrystale site and raise the skin fold between the thumb and index finger of the left hand. Once the skin fold has been raised, mark its center with a cross. The fold runs slightly downwards anteriorly as determined by the natural fold of the skin. Supraspinal skin fold site. Definition: the point at the intersection of two lines. 1. The line from the marked iliospinale to the anterior axillary border, and 2. The horizontal line at the level of the marked iliocrystale. Subject position. The subject assumes a relaxed standing position with the arms hanging by the sides. The right arm may be abducted after the anterior axillary border has been identified. Location. The fold runs slightly downwards and anteriorly as determined by the natural fold of the skin. Mid-trochanterion tibiali laterali. Definition: the midpoint of the straight line joining the trochanterion and tibiali laterali. Subject position. The subject assumes a relaxed position with the left arm hanging by the side and the right forearm across the trunk. Location. Measure the linear distance between the trochanterion and tibiali laterali landmarks. Place a small cross or other appropriate mark at the midpoint between these two landmarks. Front thigh skin fold site. Definition: the point at the midpoint of the perpendicular distance between the inguinal point and the coronal plane through the anterior patella. Subject position. The subject assumes a seated position with the torso erect and the arms hanging by the sides. The knee of the right leg should be bent at a right angle. Location. The measurer stands facing the right side of the seated subject on the lateral side of the thigh. If there is difficulty locating the inguinal fold, the subject should flex the hip to make a fold. Place a small horizontal mark at the level of the midpoint between the two landmarks. Now draw a perpendicular line to intersect the horizontal line. This perpendicular line is located in the midline of the thigh. If a tape is used, be sure to avoid following the curvature of the surface of the skin. Medial calf skin fold site. Definition: the point on the most medial aspect of the calf at the level of the maximal girth. Subject position. The subject assumes a relaxed standing position with the arms hanging by the sides. The subject's feet should be separated with the weight evenly distributed. Location. The level of the maximum girth is determined by trial and error. It is found by using the middle fingers to manipulate the position of the tape in a series of up or down measurements. Once the maximum level is located, the point is marked on the medial aspect of the calf with a small cross or other suitable mark. Mid-acromiale radiali. biceps skin fold site. Triceps skin fold site. Mid-stylion. Subscapulare. Subscapular skin fold site. Abdominal skin fold site. Iliocrystale. Iliac crest skin fold site. Supraspinale skin fold site. Mid-trochanterian tibiale laterale. Front thigh skin fold site. Medial calf skin fold site.
Basic 4. Since the basic 4, weight, stature, sitting height, and span, can be taken in any sequence, and no choreography is recommended, the preview and review sections are omitted here, and only the details are provided. Weight and mass. Weight is equal to mass times the acceleration of gravity, 9.81 meters per second squared. A person with a 70 kilogram mass will weigh 686.7 newtons. Those large numbers are one reason why we measure weight, but give the results in units of mass. The subject stands on the center of the scales without support and with the weight evenly distributed on both feet. Note: body mass exhibits diurnal variation of about 1 kilogram in children and 2 kilograms in adults. The most stable values are those obtained routinely in the morning, 12 hours after food and after voiding. Since it is not always possible to standardize the measurement time, it is important to record the time of day when measurements are made. The stretch stature method requires the subject to stand with the heels together and the heels, buttocks, and upper part of the back touching the scale or wall. The head, when placed in the Frankfurt plane, need not be touching the scale or wall. The Frankfurt plane is achieved when the orbitale, the lower edge of the eye socket, is in the same horizontal plane as the trageon, the notch superior to the tragus of the ear. When aligned, the vertex is the highest point on the skull. Positioning the head in the Frankfurt plane is achieved by placing the tips of the thumbs on each orbitale and the index fingers on each trageon, then horizontally aligning the two. The subject is then instructed to take and hold a deep breath, and while keeping the head in the Frankfurt plane, the measure applies gentle upward lift through the mastoid processes. The recorder places the headboard firmly down on the vertex, compressing the hair as much as possible. The recorder further assists by watching that the heels do not leave the floor and that the position of the head is maintained in the Frankfurt plane. Measurement is taken at the end of a deep inward breath. Sitting height. Definition: the perpendicular distance between the transverse planes of the vertex and the inferior aspects of the buttocks when seated. Method: the preferred technique is the stretch stature method. The subject is seated on a measuring box or level platform. The subject is instructed to take and hold a deep breath, and while keeping the head in the Frankfurt plane, the measure applies gentle upward lift through the mastoid processes. The recorder places the headboard firmly down on the vertex, crushing the hair as much as possible. Care must be taken to ensure the subject does not contract the gluteal muscles nor push with the legs. Note: repeated measures should be taken as near as possible to the same time of day as the original measurement. The time of measurement should be recorded on the performer. Marks placed on the paper on the wall, indicating the stature or sitting height of subjects, can have their vertical distances measured to a line of known height, also placed on the paper. This facilitates the measuring process by not requiring that each measurement be made to the floor or the measuring box. Arm span. The distance from the tip of the middle finger of the left hand to the tip of the middle finger of the right hand, when the palms are facing forward on the wall and the outstretched arms are abducted to the horizontal at the shoulders. Normally, this is obtained in a corner of the room. Instruct the subject to face the wall, raise the arms to the horizontal, and place the hands flat on the wall. Place one finger in the corner or abutment. Hold the subject's opposite wrist and encourage the subject to stretch as far as possible. The recorder can hold the other wrist, ensuring the fingertip is kept at the abutment. Record the maximum span with a mark on the wall or on paper affixed to the wall. Some anthropometrists prefer to take arm span with the subject facing out from the wall. Lengths. Direct lengths. These represent segment lengths and are measured as the shortest distances between adjacent landmarks. For example, trochanterian to tibiale laterale is direct thigh length. Derived lengths. Projected heights are the vertical distances of landmarks from the floor. Sometimes a box is used to facilitate this measurement. Derived lengths are calculated as the differences between projected heights. For example, trochanterian height minus tibiale laterale height is equal to derived thigh length. Acromiale radiale. Radiale stylion. Mid-stylion dactylion. Iliospinale height. Trochanterian height. Trochanterian tibiale laterale. Tibiale laterale height. Tibiale mediale spherion tibiale. Acropodion paternion. Acromiale radiale. Definition: the linear distance between the acromiale and radiale sites. Subject position: the subject assumes a relaxed standing position with the arms hanging by the sides. The right forearm should be pronated. Method: this measurement represents the length of the upper arm. One branch of the caliper or segmometer is held on the acromiale, while the other branch is placed on the radiale. If the branches of the segmometer are too short to allow clearance of the deltoids, a large sliding caliper should be used. Radiale stylion. Definition: the linear distance between the radiale and stylion sites. Subject position: the subject assumes a relaxed position with the arms hanging by the sides. The right forearm should be slightly externally rotated to a mid-pronated position. Method: this measurement represents the length of the forearm. It is the distance between the previously marked radiale and stylion landmarks. One caliper or segmometer branch is held against the radiale and the other branch is placed on the stylion landmark. Mid-stylion dactylion. Definition: the linear distance between the mid-stylion and dactylion sites. Subject position: the subject assumes a relaxed standing position with the left arm hanging by the side. The right elbow is partially flexed, forearm supinated, and the fingers extended but not hyperextended. Method: this measurement represents the length of the hand. One branch of the caliper or segmometer is placed on the marked mid-stylion line, while the other branch is positioned on the dactylion. Iliospinale height. Definition: the vertical distance from the iliospinale site to the standing surface. Subject position: the subject assumes a standing position with the feet together and the arms hanging by the sides. Method: the height from the top of the box or the floor to the iliospinale is measured. If a box is used, the subject stands with the feet together facing the box, so that the toes are placed in the cutout portion of the box. The base of the anthropometer or fixed branch of the segmometer is placed on the floor or on top of the box. The anthropometer or segmometer is oriented vertically with the moving branch positioned at the marked iliospinale site. Note: the iliospinale height is the height from the standing surface to the iliospinale landmark, and this should be entered onto the proforma. If the box is used, the iliospinale height is obtained by adding the box height to the height from the top of the box to the iliospinale. Trochanterian height. Definition: the vertical distance from the trochanterian site to the standing surface. Subject position: the subject assumes a standing position with the feet together and the arms hanging by the sides. Method: the height from the top of the box to the trochanterian is measured. If a box is used, the subject stands with feet together and the lateral aspect of the right leg against the box. The base of the anthropometer or fixed branch of the segmometer is placed on top of the box. The anthropometer or segmometer is oriented vertically, with the moving branch positioned at the trochanterian site. Note: trochanterian height is the height from the standing surface to the trochanterian landmark, and this should be entered onto the proforma. If a box is used, the trochanterian height is obtained by adding the box height to the height from the top of the box to the trochanterian. Tibiale laterale height. Definition: the vertical distance from the tibiale laterale site to the standing surface. Subject position: the subject assumes a standing position with the feet together or slightly apart and the arms hanging by the sides. Method: it is usual practice to have the subject stand on the box while the base of the anthropometer or fixed branch of the segmometer is on the top of the box and the moving branch is placed on the marked tibiale laterale site. The anthropometer or segmometer should be held in the vertical plane. The height from the tibiale laterale to the top of the box is then measured. Trochanterian tibiale laterale. Definition: the linear distance between the trochanterian and tibiale laterale sites. Subject position: the subject assumes a standing position with the feet together and the arms folded across the thorax. Method: this represents the length of the thigh. One branch of the anthropometer or segmometer is placed on the marked trochanterian, and the other branch is placed on the marked tibiale laterale site. Tibiale mediale, spherion tibiale. Definition: the linear distance between the tibiale mediale and the spherion tibiale sites. Subject position: the subject is seated with the right ankle resting over the left knee so that the medial aspect of the leg is able to be measured. Method: this represents the length of the tibia. One branch of the anthropometer or segmometer is placed on the marked tibiale mediale site, and the other branch is positioned on the marked spherion site. Foot length. Definition: perpendicular distance between the coronal planes of the paternion and acropodion. Subject position: the subject assumes a relaxed standing position with the feet comfortably apart and the weight evenly distributed. The arms are hanging by the sides. Subject position: the subject assumes a relaxed standing position with the feet comfortably apart and the weight evenly distributed. The arms are hanging by the sides. Method: to facilitate accurate measurement, the caliper scale should be aligned parallel to the long axis of the foot. The long axis of the foot runs through the second digit. Minimal pressure is applied to the large sliding caliper. It is more convenient for the measurer if the subject stands on the box during this measurement. Acromiale radiale. Radiale stylion. Mid-stylion dactylion. Iliospinale height. Trochanterian height. Trochanterion tibiale laterale. Tibiale laterale height. Tibiale mediale, spherion tibiale. Acropodion paternion. Breadths. Biacromial breadth. Biiliocrystal breadth. Transverse chest breadth. Anterior-posterior chest depth. Biepicondylar humerus breadth. Bistyloid wrist breadth. Hand breadth. Biepicondylar femur breadth. Ankle breadth. Foot breadth. Biacromial breadth. Definition: the linear distance between the most lateral aspects of the acromion processes. Subject position: the subject assumes a relaxed standing position with the arms hanging by the sides. Method: this distance is measured with the branches of the large sliding caliper placed on the most lateral points of the acromion processes, below the marked acromiale landmark. The subject stands with the arms hanging at the sides, and the measurer, standing behind the subject, should bring the caliper branches into the acromion processes at an angle of about 30 degrees, pointing upwards. Pressure should be applied to compress the overlying tissues, but should not move the shoulders. Biiliocrystal breadth. Definition: the linear distance between the most lateral points of the iliac crests. Subject position: the subject assumes a relaxed standing position. Method: the measurer stands in front of the subject, and the branches of the anthropometer are kept at about 45 degrees, pointing upwards. Firm pressure is applied by the anthropometrist to reduce the effect of overlying tissues. Transverse chest breadth. Definition: the breadth of the thorax perpendicular to its long axis, when the scale of the caliper is at the level of the mesosternale, and the blades are positioned at an angle of 30 degrees downwards from the horizontal. Subject position: the subject assumes a relaxed standing or seated position, with the arms abducted sufficiently to allow the caliper branches to be positioned at the lateral borders of the ribs. Method: the downward angle of the caliper will prevent the caliper from slipping between the ribs. The measurer stands in front of the subject, who may be either seated or standing. Care must be taken to avoid inclusion of the pectoralis major or latissimus dorsi muscles. Gentle pressure is exerted to compress soft tissue, but should not be sufficient to compress the ribs. The measurement is taken at the end of a tidal expiration. Anterior-posterior chest depth. Definition: the depth of the thorax perpendicular to its long axis at the level of the mesosternale. Subject position: the subject assumes a seated position with the torso erect and the palms resting on the thighs. Method: hold the rounded tips of the caliper branches between the thumb and digits 2 and 3 so that the tips are placed on the landmarks with very light pressure. The measurer applies the caliper over the right shoulder of the subject, who is instructed to breathe normally. The rear branch of the caliper should be positioned on the spinous process of the vertebra at the level of the mesosternale. Measurement is taken at end tidal expiration. Biepicondylar humerus breadth. Definition: the linear distance between the most lateral aspect of the lateral humeral epicondyle and the most medial aspect of the medial humeral epicondyle. Subject position: the subject assumes a relaxed standing or seated position. The right arm is raised anteriorly to the horizontal, and the forearm is flexed at right angles to the arm. Method: with a small sliding caliper gripped correctly, use the middle fingers to palpate the epicondyles of the humerus, starting proximal to the sites. The bony points first felt are the epicondyles. Place the caliper faces on the epicondyles and maintain strong pressure with the index fingers until the value is read. Because the medial epicondyle is normally lower than the lateral epicondyle, the measured distance may be somewhat oblique. Bistyloid wrist breadth. Subject position: the subject assumes a relaxed sitting position with the left arm hanging by the side. The right forearm is pronated, with the hand resting on the right knee. The wrist breadth is the minimal distance between the most medial point of the styloid process of the ulna and the most lateral point of the styloid process of the radius. Hand breadth. Subject position: the subject assumes a relaxed sitting position with the left arm hanging by the side. The right forearm is pronated, with the hand resting on the right knee. The hand breadth is the minimal distance between the metacarpale laterale and the metacarpale mediale when the subject firmly grasps a pencil. This is the preferred technique, especially in children. Hold the small bone caliper, pointing the branches downward at a 45-degree angle. Palpate the landmarks with the third fingers. Then apply the faces of the caliper with firm pressure, but not to the extent of compressing the width. Biepicondylar femur breadth. Definition: the linear distance between the most lateral aspect of the lateral femoral epicondyle and the most medial aspect of the medial femoral epicondyle. Subject position: the subject assumes a relaxed seated position with the hand clear of the knee region. The right leg is flexed at the knee to form a right angle with the thigh. Method: the distance is measured between the medial and lateral epicondyles of the femur. With the subject seated and the caliper in place, use the middle fingers to palpate the epicondyles of the femur, beginning proximal to the sites. The bony points first felt are the epicondyles. Place the caliper faces on the epicondyles and maintain strong pressure with the index fingers until the value is read. Ankle breadth. Subject position: the subject assumes a relaxed position with the feet comfortably apart. Ankle breadth is the minimal distance between the maximal protrusions of the medial tibial malleolus and the lateral fibular malleolus. Apply the small bone caliper at a 45-degree angle downwards, perpendicular to the long axis of the foot. The caliper should encompass the landmarks with firm pressure. These measurements may be taken from the front or the rear of the subject. Foot breadth. Subject position: The subject assumes a relaxed standing position, with the feet comfortably apart and the weight evenly distributed. Foot breadth is the minimal distance between the metatarsale fibulae and the metatarsale tibiale. Apply a small bone caliper at a 45-degree angle downwards, perpendicular to the long axis of the foot. The caliper should encompass the landmarks with firm pressure. Biacromial breadth. Biiliocrystal breadth. Transverse chest breadth. Anterior-posterior chest depth. Biepicondylar humerus breadth. Bistyloid wrist breadth. Hand breadth. Biepicondylar femur breadth. Ankle breadth. Foot breadth. Girth measurements. Head girth. Neck girth. Arm relaxed girth. Arm flexed and tensed. Forearm girth. Wrist girth. Chest girth. Waist girth. Gluteal or hip girth. Thigh girth. Mid-thigh girth. Calf girth. Ankle girth. Head girth. Definition: the circumference of the head immediately above the glabella and perpendicular to the long axis of the head. Subject position. The subject assumes a relaxed seated or standing position with the arms hanging by the sides and the head in the Frankfurt plane. Method. The tape needs to be pulled tight to compress the hair. Use of the middle fingers at the sides of the head is often necessary to prevent the tape from slipping over the head. Do not include the ears and ensure that there are no hairpins, clips, or similar items in the hair during the measurement. Neck girth. Definition: the circumference of the neck immediately superior to the thyroid cartilage, or Adam's apple, and perpendicular to the long axis of the neck. Subject position. The subject assumes a relaxed seated or standing position with the arms hanging by the sides and the head in the Frankfurt plane. Method. The subject should maintain the head in the Frankfurt plane. It is important not to pull the tape tight in this region since the tissues are compressible. The tape is held perpendicular to the long axis of the neck, which may not necessarily be in the horizontal plane. Arm relaxed girth. Definition: the circumference of the arm at the level of the mid-acromiale radiale site, perpendicular to the long axis of the arm. Subject position. The subject assumes a relaxed standing position with the arms hanging by the sides. The subject's right arm is abducted slightly to allow the tape to be passed around the arm. Arm flexed and tensed. Definition: the circumference of the arm perpendicular to the long axis of the arm at the level of the peak of the contracted biceps, when the arm is raised anteriorly to the horizontal. Subject position. The subject assumes a relaxed standing position with the left arm hanging by the side. The subject's right arm is raised anteriorly to the horizontal with the forearm supinated and flexed at about 45 to 90 degrees to the arm. Method. The measurer stands to the side of the subject and with the tape loosely in position. The subject is asked to partially tense the elbow flexors to identify the probable peak of the contracted muscles. The subject is encouraged to contract the arm muscles as strongly as possible and hold it while the measurement is made at the peak of the biceps. If there's no obvious peak of the biceps, this girth should be measured at the level of the mid-acromiale radiale landmark. Forearm girth. Definition: the maximal circumference of the forearm perpendicular to its long axis, distal to the humeral epicondyles. Subject position. The subject assumes a relaxed standing position with the left arm hanging by the side. The subject's right arm is slightly flexed at the shoulder and the elbow is extended. Method. The subject holds the palm up with the forearm supinated while relaxing the muscles of the forearm. Move the tape measure up and down the forearm and make serial measurements in order to correctly locate the level of the maximum girth. It usually occurs just distal to the elbow. Wrist girth. Definition: the minimal circumference of the wrist perpendicular to the long axis of the forearm, distal to the styloid processes. Subject position. The subject assumes a relaxed standing position. The subject's right arm is flexed at the elbow, the forearm supinated, and the hand relaxed. Method. Manipulation of the tape measure is required to be sure the minimal girth is obtained. The tissue should not be compressed by excessive tension. Chest girth. Definition: the circumference of the thorax at the level of the mesosternale site, perpendicular to the long axis of the thorax. Subject position. The subject assumes a relaxed standing position, with the arms hanging by the sides and slightly abducted. Method. The anthropometrist stands to the right of the subject, who abducts the arms to the horizontal position, allowing the tape to be passed around the thorax. The stub of the tape and the housing are then both held in the right hand, while the anthropometrist uses the left hand to adjust the level of the tape at the back to the adjudged level of the marked mesosternale. The anthropometrist resumes control of the stub with the left hand, and using the cross-hand technique, positions the tape in front at the level of the marked mesosternale. The subject is instructed to lower their arms to the relaxed position, with the arms slightly abducted. The tape is then readjusted as necessary to ensure it has not slipped and does not excessively indent the skin. The subject should breathe normally, and the measurement is taken at the end of a normal expiration, or end tidal. Waist girth. Definition: the circumference of the abdomen at its narrowest point between the lower costal or 10th rib border and the top of the iliac crest, perpendicular to the long axis of the trunk. Subject position. The subject assumes a relaxed standing position. Method. The anthropometrist stands in front of the subject, who abducts the arms slightly, allowing the tape to be passed around the abdomen. The stub of the tape and the housing are then both held in the right hand, while the anthropometrist uses the left hand to adjust the level of the tape at the back to the adjudged level of the narrowest point. The anthropometrist resumes control of the stub with the left hand, and using the cross-hand technique, positions the tape in front at the target level. The subject is instructed to lower their arms to the relaxed position. The tape is then readjusted as necessary to ensure it has not slipped and does not excessively indent the skin. The subject should breathe normally, and the measurement is taken at the end of a normal expiration, or end tidal. If there is no obvious narrowing, the measurement is taken at the midpoint between the lower costal or 10th rib border and the iliac crest. Gluteal or hip girth. Definition: the circumference of the buttocks at the level of their greatest posterior protuberance, perpendicular to the long axis of the trunk. Subject position. The subject assumes a relaxed standing position with the arms folded across the thorax. The subject's feet should be together and the gluteal muscles relaxed. Method: the anthropometrist passes the tape around the hips from the side. The stub of the tape and the housing are then both held in the right hand, while the anthropometrist uses the left hand to adjust the level of the tape at the back to the adjudged level of the greatest posterior protuberance of the buttocks. The anthropometrist resumes control of the stub with the left hand, positions the tape in front and the sides so that the tape is held in a horizontal plane at the target level. The tape is then readjusted as necessary to ensure it has not slipped and does not excessively indent the skin. Thigh girth. Definition: the circumference of the thigh 1 centimeter distal to the gluteal fold site, perpendicular to its long axis. Subject position. The subject assumes a relaxed standing position with the arms folded across the thorax. The subject stands with the feet slightly apart and mass equally distributed on both feet. Method: it is usually helpful to have the subject stand on a box or stool for this measure. The anthropometrist passes the tape between the lower thighs and then slides the tape up to the correct plane. The anthropometrist resumes control of the stub with the left hand, and using the cross-hand technique, positions the tape so that it is held in a perpendicular plane. The tape is then readjusted as necessary to ensure it has not slipped and does not indent the skin. Mid-thigh girth. Definition: the circumference of the thigh measured at the level of the mid-trochanterion tibiale laterale site, perpendicular to its long axis. Subject position: the subject assumes a relaxed standing position with the arms folded across the thorax. The subject's feet should be separated with the weight evenly distributed. Method: it is usually helpful to have the subject stand on a box or stool for this measure. The anthropometrist passes the tape between the lower thighs and then slides the tape up to the correct plane. The anthropometrist resumes control of the stub with the left hand and, using the crosshand technique, positions the tape so that it is held in a perpendicular plane. The tape is then readjusted as necessary to ensure it has not slipped and does not indent the skin. Calf girth. Definition: the circumference of the leg at the level of the medial calf skinfold site, perpendicular to its long axis. Subject position: the subject assumes a relaxed standing position with the arms hanging by the sides. The subject's feet should be separated with the weight evenly distributed. Method: the subject stands in an elevated position. The elevated position will make it easier for the measurer to align the eyes with the tape. The anthropometrist passes the tape around the calf and then slides the tape to the correct plane. The anthropometrist resumes control of the stub with the left hand, positions the tape so that it is held in a plane perpendicular to the axis of the leg. The tape is then readjusted as necessary to ensure it has not slipped and does not indent the skin. Ankle girth. Definition: the minimal circumference of the ankle superior to the spherion tibiale site, perpendicular to the long axis of the leg. Subject position: the subject assumes a relaxed standing position with the arms hanging by the sides. The subject's feet should be separated with the weight evenly distributed. Method: the subject stands in an elevated position. The elevated position will make it easier for the measurer to align the eyes with the tape. The anthropometrist passes the tape around the ankle and manipulates it up and down this region to ensure that the minimum girth is obtained. The anthropometrist resumes control of the stub with the left hand and positions the tape so that it is held in a plane perpendicular to the axis of the leg. The tape is then readjusted as necessary to ensure it has not slipped and does not excessively indent the skin. Mere visual inspection only from the side usually does not reveal the minimal girth. Head girth. Neck girth. Arm relaxed girth. Arm flexed and tensed. Forearm girth. Wrist girth. Chest girth. Waist girth. Gluteal or hip girth. Thigh girth. Mid-thigh girth. Calf girth. Ankle girth. Skin folds. Triceps. Subscapular. Biceps. Iliac crest. Supraspinale. Abdominal. Front thigh. Medial calf. Triceps. Definition: the skin fold measurement taken parallel to the long axis of the arm at the triceps skin fold site. Subject position: the subject assumes a relaxed standing position. The right arm should be relaxed with the shoulder joint slightly externally rotated and the elbow extended by the side of the body. Subscapular. Definition: the skin fold measurement taken with the fold running obliquely downwards at the subscapular skin fold site. Subject position: the subject assumes a relaxed standing position with the arms hanging by the sides. Method: The line of the skin fold is determined by the natural fold lines of the skin. Biceps. Definition: the skin fold measurement taken parallel to the long axis of the arm at the biceps skin fold site. Subject position: the subject assumes a relaxed standing position. The right arm should be relaxed with the shoulder joint slightly externally rotated and the elbow extended by the side of the body. Iliac crest. Definition: the skin fold measurement taken near horizontally at the iliac crest skin fold site. Subject position: the subject assumes a relaxed standing position. The right arm should be either abducted or placed across the trunk. Method: the line of the skin fold generally runs slightly downward from posterior to anterior, as determined by the natural fold lines of the skin. Supraspinally. Definition: the skin fold measurement taken with the fold running obliquely and medially downward at the supraspinally skin fold site. Subject position: the subject assumes a relaxed standing position with the arms hanging by the sides. Method: the fold runs medially downward and anteriorly at about a 45-degree angle as determined by the natural fold of the skin. Abdominal. Definition: the skin fold measurement taken vertically at the abdominal skin fold site. Subject position: the subject assumes a relaxed standing position with the arms hanging by the sides. Method: it is particularly important at this site that the measurer is sure the initial grasp is firm and broad, since often the underlying musculature is poorly developed. This may result in an underestimation of the thickness of the subcutaneous layer of tissue. Note: do not place the fingers or caliper inside the navel. Front thigh. Definition: the skin fold measurement taken parallel to the long axis of the thigh at the front thigh skin fold site. Subject position: the subject assumes a seated position at the front edge of the box, with the torso erect and the arms hanging by the sides. The knee of the right leg may be bent at a right angle, or in some subjects, it may be easier to take the knee extended. Method: because of difficulties with this skin fold, 3 methods are recommended. Be sure to record on the proforma the method used and to indicate whether the knee is bent or extended. Method A. The measurer stands facing the right side of the subject on the lateral side of the thigh. The skin fold is raised at the marked site. The skin fold measurement is taken while the knee is bent. Method B. If the fold is difficult to raise, the subject is asked to assist by lifting with both hands the underside of the thigh to relieve the tension on the skin. Method C. For subjects with particularly tight skin folds, the subject is asked to assist by lifting the underside of the thigh as in B. The recorder, standing on the medial aspect of the subject's thigh, assists by raising a fold at about 6 centimeters on the side of the landmark. The measurer then raises the skin fold at the marked site. If the skin fold is difficult to take with the knee flexed, ask the subject to extend the knee. Any of the 3 methods may be used with the knee extended if necessary. Medial calf. Definition: the skin fold measurement taken vertically at the medial calf skin fold site. Subject position: The subject assumes a relaxed standing position with the right foot placed on the box. The right knee is bent at about 90 degrees. Method: the subject's right foot is placed on the box with the calf relaxed. The fold is parallel to the long axis of the leg. Triceps. Subscapular. Biceps. Iliac crest. Supraspinale. Abdominal. Front thigh. Medial calf.